So I understand you had, what was it, like a ice hockey accident? You
Right.
got banged over here?
Yeah, about 15 years ago, left side of the chest.
Uh-huh.
And my arm was kind of pulled back, so I don't know if it was that or the arm pulling, but that's when my snapping started. Snap, snaps, crack, 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 snap, snap.
And since then on, for the past 15 years, what are the problems you started noticing from that?
Well, that was the first thing, and I was treating it, but nothing really made it go away. From that, the right side started hurting. That was next. Third was pain here.
Uh-huh. Actually, you know what? Let's show the viewers. Turn around. You mentioned about trying to reach behind with your left. How far can you reach up?
I can reach up to here,
Uh-huh.
and
What do you want?
here. That's all I go.
All right. Let's see how far this will go. See, so this one you can reach pretty high, and this one that is high. This is what we call the Apley scratch test, and this is definitely a positive sign. With your right shoulder, this is not functioning as well as the left one, because it should be symmetrical. It should be the same height. Clearly, it's not. Right?
Right.
So there's something going on with this one. Okay, go ahead and relax this over here. You also mentioned what's going on with the rib.
So the rib pain hurts here. I did have a fall about a year ago and fell kind of off like a chair and landed on my elbow. And I think since then, that's when this started really just hurting like a little bit. But then in the past like 2-3 months, this has really started acting up to the point where I had like shooting pains and throughout my whole chest, my arms, like it was just really bad inflammation and pain.
So let's start off with instrumentation. We're looking for signs of inflammation. And one of the indicators is abnormal heat. That's what this device picks up. And we found something at this level here. Take a look at the other ones. And we have something going on at this level here as well. Another that we see and point out upon visualization, see there's a skin break right over here, a little pimple. So that usually happens when the nerve is getting irritated and it'll break out like this. So that's another confirmation that there's something going on at this particular level. So let's take a look, scan the rest of the spine. And we have another reading at this level. So visualization right off the bat. A lot of swelling right, concentrated in this region over here. How's this fella? Not bad at all?
Not bad.
Yeah, sacroiliac joints, there's no swelling, no edema there. See how that's moving? Those are fine. Those are fine as well. No problems. We have some edema right between the 5th and the 4th lumbar right here. Let's test that 5th. How's that fella right there?
Yeah, not too bad.
That's moving quite decently, but this 4th, this is stuck.
Yeah.
So we got a lot of swelling right over here as well. It's just very subtle, but it is here. It's chronic. It's been there for quite some time. So, and on top of it, it's stuck. The muscles are tight on the right side.
That's what hurts really bad, the muscles there.
So this is the fellow. Yeah. Feel that bogginess right here? Right? You hear it?
Yeah.
It even sounds different.
Yeah.
Right? So you got a lot of swelling right here as well. It's just chronic, but there is swelling right here. Because it should sound the same, but it's not. So there's a chronic swelling right here. See, it's not even moving that right either. This is the one we also need to address. Well, we tested confirmed that 4th lumbar, this is the one that's not the horizontal abdominal effect. And as we see over here, since this one to the right, this one to the left, see that one took just too much strain. So I'll explain why you also experience some of that lower rib pain as well. And over here, this 6th dorsal, because of the way it's tweaked and rotated significantly in terms of everything else, all these ribs, especially that rib that's just tracing all around here, right? Come for that fella.
Feels a lot looser.
What does?
The kind of like the whole rib area here.
Oh, you know what? Let's show the viewers what can you do. Once again, reach behind with your left. Okay, try the right.
Wow. That's a lot higher, right?
Yeah,
Yeah,
it's
it's
so much higher. Go ahead. Go you raise with your left one. See, they're almost the same. It's
Almost,
just only
yeah.
1 inch apart.
Yeah.
And all we corrected was just your 4 lumbar.
Wow.
Yeah, how do you like that, fella, huh?
Great.
Okay, let's rock and roll. Let it go. Let it go. Let it go. Let it. Oh, there it is. Give her a roll, brother.
Oh yeah.
Oh yeah, what?
I'm able to move all the way with no pain.
Mm-hmm. Alright, so now let's turn around and see what you can do with your shoulders. Okay, reach behind with your left. Okay, reach behind you with your right. Let's do the left one again. Keep it up. How do you like that? Almost the same.
Wow.
Look at that. I'll show the viewers right there. Maybe like half an inch. Checking your SC joint. AC. AC is a little bit stuck. You just gotta motion that out. There it goes. Now it's moving. Check out scapula. And a little bit out. Okay. Humerus is slightly out. It's anterior. All right. Let's realign this fella. Put it back in proper position. Okay, walk around so you like it.
Much better.
Yeah.
Mhm. Yeah, definitely much better. Still tight here though. A little painful too, you know?
That's
This has
why-
always been, this part here
Mhm.
has always been kind of like a little forward,
Mhm.
a little painful.
Well, that's what I want you to do over here. Okay?
Mhm.
I need you to ice this because this is chronic swelling.
Right.
Just ice it up 20 minutes, 3 times a
3
day.
times a day.
Keep that up for the next 2 weeks.
Mhm.
As that swelling goes down, the nerve will start functioning a lot more efficiently as it should.
Right.
And then over time, you'll know the shoulder complex will start healing and functioning as the way it should.
Okay.
Right?
Awesome.
All right?
All right.
You all set, champ?
Great. Thanks.
Oh,
Appreciate
you're
it.
welcome.
Thank you so much.